Can I feed AI all my health conditions, my age, my weight, my height, what I'm trying to achieve, and let ChatGPT tell me what I should eat and not eat?
100%.
Oh.
When you look at like a well-trained athlete and a not trained athlete, they have more mitochondria and they have bigger mitochondria. As soon as we're taking away pleasure, generally, that's not something that's going to be sustainable in the longer term. It can reduce your blood pressure by 8 to 12 millimeters of mercury. But that's almost more than a pill I give you.
Welcome to the Visionary podcast, where we discuss science, medicine, physical health, and mental well-being.
So, in the context of heart disease, over the phone, when we had our chat over the phone, you said to me that medicine is an art as well as a science. I loved that sentence. What did you mean, please?
We have guidelines, and those guidelines will say, thinking of this diagnosis, do this test or do this treatment. If that doesn't work, move on to the next step. But we should recognize that these are guidelines, and every patient is different. And the more I practice medicine, the more I realize that the most important thing is to get to understand the patient and hopefully be able to explain what I think we should do. But it's a conversation with the patient. It's their body. It's their decision about what they put in it or what investigations they have done. So, I spoke to someone on Friday who had a raised PSA test.
Is that privately or
no, in the NHS? So as a GP I was working as. And he's a 60-year-old chap who came to see me with some increased urinary symptoms. So getting up in the middle of the night, classic. As he's getting older, his prostate's probably grown a bit too much and it's impacting how much urine he's able to expel, which means that actually his bladder doesn't empty fully. So every time he goes for a wee, he might squeeze out or have left in 150 mils of urine in his bladder, which means the bladder's like a balloon. It expands and contracts. But if you don't contract it fully, it's already half full. It means that when you then have, or your body then naturally produces urine, it then fills up much quicker than it would have done. So as part of that, we did a PSA test. It was very slightly raised. Now, if we were to follow the guidelines, we'd then have that conversation, or I did have that conversation around, we should refer you for the 2-week wait rule, which is where you get referred to the urologists. They might then do an MRI scan of your prostate. But the other conversation to be had with him was, does he have any family history? What investigations does he want done if this is positive? What's the risks associated with this? Now, I was talking to him saying, look, you've probably got a benign enlarged prostate. We could repeat this test in 6 weeks' time. If it's still raised, we can then have a further conversation about referring, or we see if it comes down, and if it's come down, then actually we don't need to do anything for him because there's no reason to refer. His test was 3.1, the cutoff is 3. These are very small, these are fine margins we're talking about. There's a very different conversation, again, going through guidelines and medicine being an art, not a science, is that if his test had come back as 9, 20, 50, then 100% we should refer, because I'm worried he's got a cancer, whereas actually his number was just slightly above. And so therefore it's having that understanding with him about what he would like to do. And his biggest concern was actually being able to go back to see his dog. And so he's like, just repeat it in 6 weeks, Guy, I'm happy with that. And in which case I'm happy, but we have a conversation, we have a plan in place, but every patient is different. So every patient, we should be exploring what they want to do. And I also think that when we talk about the art, not a science, I have medicines that I think should work, but don't. And therefore I should...
Depending on the person.
Yeah, absolutely. And how they respond and what side effects they've had from that one. And I'm like, I've never heard of that one before, but okay, if it's happened to you, it's happened to you. And so I think that's my sort of learning, is that going back to personalised care is intertwined with that art, not a science, because we are all individuals. We all have slightly different genetic makeup, slightly different ways that we interact with the world, experience, and so that's why I talk about art, not a science.
Yeah, and it all channels down into personalization. One more time, tell me the metric that would make you super optimistic about someone's longevity potential.
Oh, their VO2 max. 100% VO2 max.
Let me ask, is this a level kind of running or uphill? Because it makes a difference to me.
So the way I do, the graded exercise test that we do for running, it would be on a treadmill and we'd be going faster and faster and faster on a flat.
On a flat, running. I'm happy with that.
So we could get you done, it's fine.
I don't want to.
Don't want to.
Circling back to VO2 max again and cardio fitness, I heard of in interval? Is it interval, short interval exercises? That's like 3 or 4 minutes hard work of running or cycling or whatever. Then another 3 or 4 minutes of walking, something to keep the heart rate down, and then repeat. I've done that a few times, the Norwegian HIIT of 4 minutes. Is this something valid or?
100%. Look, if we were to talk about what's the best bang for your buck when we think about the time that we have available, our exercise should be split into 80% being what's called zone 2, which is sort of steady state exercise where you're able to ideally just about talk when you're doing the exercise. So let's take running. You're able to have a conversation with someone who's running next to you where it's feeling a little bit uncomfortable, but not terrible, and you can do it. And 20% should be of that time of our exercise should be spent with that really high intensity workouts. So absolutely between 3 to 8 minutes of maximal effort. So this can be done. So for instance, for me, I go and do either a zone 5 workout, which is what it is, on the bike, or I do it running up a hill. And it takes me 2 minutes 45 to run up a hill, and I go as hard as I can, and I'm looking at my heart rate while I'm doing it to see I should be approaching the maximum heart rate that I should be able to achieve, something around 170, 175 for me. And then I gently jog back down, which takes roughly 3 or 4 minutes, and then I turn around and repeat that 4, 5, 6 times.
Why is this pattern useful for my heart?
So the reason it's not necessarily for your heart. The reason it's good is because it goes back to the 2 ways our cells, our mitochondria, have to produce energy. So the mitochondria are the powerhouses of our cells. They're the things that produce what's called ATP, which is what we need. That is the energy for our cells, basically. And there are 2 different ways they can do it. So they can do it with oxygen and without oxygen. With oxygen is that zone 2 training. So you're effectively making them, you're giving them oxygen, and so they're able to keep chugging away. Marathon runners, or within part marathon runners, keep going. When you use the without oxygen, that's the anaerobic, so without oxygen, part of our respiration, that it produces energy, but it also produces lactic acid. So the lactic acid is the thing that builds up in our muscles and gives us that soreness. And so when we start to tailor these 2 ways, or these 2 modalities of how mitochondria produce energy, our mitochondria get bigger and they get more dense. There's more of them in our cells. So that's why these types of exercises are so important, because as you're training your zone 2, you're training your mitochondria, so the energy producing parts of our cells, to be more efficient with oxygen. And then when we do the high intensity interval training, we're training our mitochondria with the other part of our respiration, the other way that it can produce energy. And again, when you look at it under a microscope, when you look at like a well-trained athlete and a not trained athlete, they have more mitochondria and they have bigger mitochondria. They're more efficient. They're better. Just like a muscle, someone who's trained weightlifting versus someone who hasn't, there's a bigger muscle and there's a smaller muscle. Exactly the same with our mitochondria. So if you can take an initial look at someone, and you keep going down on the sizes. So you can look at the microfibers. You could look at the fibrils, which is going even smaller cells. It's all exactly the same.
Yeah, interesting. Moving back to nutrition, we touched on that a little bit. Someone is watching this episode at 2 a.m., probably eating something they shouldn't be eating. What diet should I follow if I'm aiming for longevity? And I think everyone is aiming for longevity.
So I think it's around what's sustainable and what you enjoy. If you were to say what's an easy go-to framework, 1/3 carbohydrates, 1/3 fat, 1/3 protein. But we should also take this in consideration of everything else that's going on. So for instance, if you've got high cholesterol, then what we need to be trying to do is focus on reducing, from your lifestyle perspective, how much saturated fat you're consuming. And a lot of the time when we reduce our carbohydrates, we have there are 3 crude food groups. So carbohydrates, fats, and protein. If you reduce one, then you have to increase the other one.
Yes.
That's how it
it's
works.
A balance.
Exactly. And so there's only possibly so much fish, steak, chicken you can eat. And so when we think about other ways, you have to then increase your fat intake. And that's when we should start acknowledging that there is no one diet that works perfectly for everybody. It's understanding what your risks are associated. So again, going back to high cholesterol, well, then we should focus on trying to reduce your fat intake, and specifically your saturated fat intake.
Such as?
So effectively, saturated fat is anything other than, when we're talking about meats, anything other than chicken. The other things we think about are dairy, so milk, so cream, cheese, halloumi, yogurts, all have very high saturated fat contents. And so that's when we should try and avoid eating those, and reducing the amount that we're having. But again, I know it's boring, but it's holistically looking at someone and understanding where their risk factors are associated. I say a third, because that's an easy way of us remembering some of this stuff. But it really should be, again, if you look at what's the culture that you were brought up in, what foods do you really enjoy, making sure that life's for living.
Yes.
And so making sure that you're still getting happiness and enjoyment, and because as soon as we're taking away pleasure, generally that's not something that's going to be sustainable in the longer term.
Yeah. What's your favorite longevity meal?
It's funny. I was thinking about this, and I was saying to my wife, "Oh, what's my favorite longevity? I don't know." And she went, "Yes, you do. Yes, you do." And I was like, "What?" She's like, "Your breakfast every morning." And so my favorite longevity meal is I have a high protein yogurt. I have 30 grams of almonds, 30 grams of all bran, 15 grams of chia seeds, 15 grams of flax seeds with some mixed nuts added in. And then I have my mixed berries, frozen mixed berries, which I add in. And that's my go-to high fiber, perfectly balanced.
It sounds very healthy.
Yeah, breakfast meal. And it gives you roughly about 35 grams of protein. It's 28 to 30 grams of fiber. So I've done my fiber intake for the day. And it's a perfect a third. When I went back to third carbohydrates, a third protein, a third fats. So that's my go-to. Monday to Friday, I enjoy my breakfast or brunches at the weekend, but Monday to Friday, that's my go-to meal.
Yeah, that's amazing. How about our lovely cultural favorite, the British roast? How does it fit into this? I appreciate and value my roast. So
yes, as do I. So I think if we were to say whether it's a healthy meal, typically not.
Oh.
So it's generally, depending on the meat, it's quite high saturated fat. So lamb, beef, pork.
Turkey is okay?
Turkey and chicken.
Yeah.
Turkey and chicken generally are better, way better.
Okay.
So if you have the skin, then it becomes a bit worse, or quite a bit worse. It depends how, yeah. So it's and I think also when we talk about how much salt you're consuming, generally we all have way too much salt, but everything in moderation. So right. I think with all of this stuff, if I still have a roast every week, most weeks, and I enjoy it, but it's not every day. And as soon as you add in, typically the easy things to avoid are don't have crackling, don't have skin. Once in a while, it's absolutely fine.
Yeah, I appreciate my roastings, but I used to think that it's all okay, but maybe the gravy. Yeah.
I think the gravy's not great. It depends how you make the gravy. Yes. Yeah.
Hi, I'm Hala, your host today. If you're enjoying what you see, please hit that lovely subscribe button. It would mean a lot to me and my team. Or maybe it's more now. We're still learning. We're still finding our feet. But with your support, we can build this channel. Let's take this journey together, one step at a time. Thank you so much for being part of it.
There is a lot of buzz around things like supplements and cold exposure. What's your take on them?
When I think about supplements, there are lots of different ones out there that people advocate. There is currently no data that says one makes a difference or one is better than the other, especially when you're specifically focusing on the longevity side. So these are more on the NAD plus things that people talk about. They're very expensive. I have no research to prove that it makes a blind bit of difference for your health or lifespan. I think there are things that can help. So I think, if you're a menstruating woman, ensuring that you're not iron deficient, ensuring that you've got your B12, your folic acid, vitamin D. Everyone should be on vitamin D generally in the UK because we don't have enough sunshine. So there are simple wins that we can all have from that perspective. The impact that they have in comparison to strength, fitness, lifestyle, primary prevention is significantly less than the 3 levers that I would advocate. So the interesting part about cold exposure is there is a risk of sudden onset death and cardiac arrhythmias associated with it. So I think that it's probably one of those things that is good from doing something difficult. Mentally, it's a good thing to do. Yeah. I don't think it's linked with a longer, healthier life.
That's major. When I had that a lovely chat with you over the phone, you talked about high blood pressure, and I got the impression that it's a vital metric when it comes to longevity. You explained a bit about it now, and I understand why. But can nutrition dial it down naturally somehow?
Yes. So we have really good evidence on blood pressure, and so the DASH diet, which is a low sodium diet. So guidelines would recommend less than 2 grams of salt a day. The DASH diet is less than 500 milligrams of salt in a day.
Oh, okay.
But it can reduce your blood pressure by 8 to 12 millimeters of mercury. And that's almost more than a pill I give you. So one of my pills that I have to manage your blood pressure, that's more than a pill that I have available. So it's medicine in itself.
Yeah. I have a funny question, please. Can I ask AI to plan meals for me?
Yeah.
I'm talking about ChatGPT or whatever AI people are using. Can I feed AI all my health conditions, my age, my weight, my height, what I'm trying to achieve, and let ChatGPT tell me what I should eat and not eat?
100%.
Oh, really?
I think that these large language models are amazing, and they will generally produce really good outcomes when we talk about meal prep, optimum quantities that we should be eating. And if you ask it about wanting to get your fiber intake up, soluble fiber in particular, because that's the one that's linked with lower cholesterol and lower risk of diabetes, it's got the data. It can pull it within 5 seconds to do that for you. The thing that I would say is that it's about understanding what your preferences are. So as long as you say, I hate celery, don't mention anything with celery or something on those lines. But yeah, I think it's a really good resource that we should all be using.
Your vision statement on your website talks about, and this is a quote, empowering patients to take control of their health. Now, for some of us, it might seem that this is a little bit too late. We're already playing catch up with appointments and medical conditions. Can I reverse this? Can I steer myself towards longevity, sustainable longevity, even with 1 or 2 diseases in my baggage?
Yeah, absolutely. So what's interesting about when we talk about, say, people who have got some form of chronic disease, whether that be heart disease or whether that be cancer, or whether that be something else. So you can, with heart disease, the best evidence or some of the best evidence anyway, if you've had a heart attack, for reducing your risk of having another heart attack is some of the medications we give, but actually cardiac rehab. So doing exercise ensures that is one of the best things you can do. If you've got COPD, so you've smoked and your lungs have then become damaged, the best evidence we have is pulmonary rehabilitation for ensuring that your lung function doesn't decrease any further. And again, pulmonary rehabilitation is exercise. So there is no point to which it's not going to help you. And the big message that I would be trying to throw out there is the earlier we start, the easier it is. Because you're right, sometimes people are playing catch up in their 6th, 7th decade of life. But if we started a bit 10 years earlier, it would be a much less of a hill that we'd have to climb.
Yeah, obviously, but we talk about prevention. How early should I come and see you or embark on this prevention journey? In my 30s, when I'm fit and healthy, or seemingly fit and healthy?
So I think it's about, if we would talk about ideal.
Yes, ideal.
Ideal.
The perfect
scenario. The perfect person. So you turn 18 and we then go and do your LP(a), we do your ApoB, we do all your cholesterol markers, we do your blood pressure.
Oh, really? 18?
Oh, 100%. Yeah.
Wow.
So if we were to start, because then we pick up some of the things that are things that we should be detecting at a much earlier age. Okay. That's not the likelihood of that is minimal. Yeah. It goes up because actually, as we get older, our life become more stressful. We have factors like work. We have factors like kids that start to mean that our priorities change. and we're not able to exercise as much, not able to do eat as well. And so therefore then I can pick up those metrics again. So almost like on a decade basis, that would be the ideal. So 20, 30, 40 would be is the perfect time, because that's when you can, when you've got young kids, it's really hard to do anything other than look after this sleeping, pooping, feeding child. But I think once you've been over that hump, that 6 months, 12 months, 18 months period, you've then got an opportunity to start reprioritizing what's important. And don't get me wrong, I think the importance is spending time with family, but you need to be here for that to happen. And so if I was to talk about an ideal person, I think generally 40s is a great decade, because in your 40s you've possibly started to create more time for yourself, and there's an opportunity to take back some control of your health.
That's a really valid idea. 40s and 50s, hopefully children are a bit independent, work is sorted and stable, so actually have more time to do things, so exercise more, not less. All right. So if I had to start somewhere, and this episode is all too overwhelming, what is the biggest variable that could boost my biomarkers?
That's an interesting one. So I suppose it depends on what we're testing for. So when we talk about biomarkers, we're talking about blood tests, or are we talking about your VO2 max, or are we talking about your strength? So let's say that
longevity in general.
Fine, longevity in general. Okay, the best thing you can do would go back to improving your VO2 max. So if you continued for you doing some gentle exercise, gentle running, and then you added in one session a week where you did a high intensity interval training session where you did 3 to 8 minutes of really hard work, where you were pushing yourself to the max, and then had a 1-to-1 rest period, so had then 3 or 8 minutes of rest, and then repeated that. That can improve your VO2 max. You start doing that can improve your VO2 max by 10% in 6 weeks.
What about the biggest longevity mistake that we all make?
I think the biggest longevity mistake is twofold. One would be thinking that I fix one thing and I've fixed everything. So I'm doing some exercise, I'm going to live longer, healthier. That's in part the package, but it's not everything. Or I'm taking a statin, therefore my cholesterol's sorted, I don't need to think about anything else now. But the other thing would be people who make big lifestyle changes over a short period of time. And I more mean if they suddenly cut all processed foods out of their diet and exercise every day for multiple hours. I worry for them that actually, one, they develop an injury, confident, or something stressful happens, and then they fall off the bandwagon, and then actually it's very hard for them to get back on the saddle. So I think it goes back to what's sustainable and what you can continue to do and in the longer term.